Hello, my name is Dr. Brian Raid, and I'm a naturopathic doctor. And this is a video that's in reply to a question that was posted on one of my other videos. So I'm going to read it because it's a little bit wordy, but it's a good question, and I think the information will apply to other folks as well. So it says, I'm almost positive I have fungal sinusitis due to mold in my shower for a long time. The mold's gone, but I'm still having issues for about a year now. My only symptoms are postnasal drip and fatigue, but it's extremely annoying, and it gets worse with eating certain foods. The person understands that some people use neti pots with xylitol, iodine, silver, etc., but how would one be able to kill the biofilm in the upper and maxillary sinuses to keep the biofilm and mold from coming back? So there's some of the really deep, hard to get at sinuses. The person's taking a glutathione precursor. They've been detoxing and feeling better, which is great to hear. And then saying that in the long run, they know that it's not going to be enough and that more invasive actions are likely needed. Is there anything I can suggest to put the postnasal drip and fatigue away for good? Any help at all is much appreciated. So thank you for the question. It's a good question because at the end of the day, working with things like binders and detox support, it's something that can be really helpful for mitigating symptoms, helping treatment to be better tolerated, but ultimately it's not going to kill mold and it's not going to get at biofilms. So they're very good. It's a very good question. As I say in all of my videos, I can't give any medical advice in any way, shape, or form through social media. I can only give advice to folks who are my patients and the confines of a doctor-patient relationship. So I can't give you any health advice directly. You have to talk to your own personal health care authority or provider to give you direct advice. What I can say though, just for informational purposes, is that thinking about the nooks and crannies and those deepest sinus recesses, I think is a really important thing to think about when we want to really thoroughly treat sinuses. Neti pots, I think, can be great. The thing that I consider though when thinking about neti pots is what is the concentration of the substance that I'm exposing the sinuses to, and how long is it actually going to be in that region for? So in other words, if I have my neti pot, like I've had patients come in and I tell them about my different nasal sprays I recommend. I'm like, oh, I'm already doing like frankincense or thyme essential oil or whatnot up my schnoz. I'm using it in a neti pot. It's like, well, if you're putting say 5 or 10 or even 20 drops of essential oil in a neti pot, how much is that getting diluted down? And how much time is it actually spending in contact with the walls of the sinus themselves? And in my rough calculations indicate not nearly as much as when I'm say using a nasal spray, or if I was going to use a nebulizer, which is basically a device that will turn a liquid medication into a vapor form that can be breathed in. So if I'm literally fumigating my sinuses with a nasal spray, or more potent step up from that would be with a nebulizer, that's just going to keep this like steady stream of very much more concentrated essential oil infused vapor essentially coming into contact with those various areas of the sinuses. So there's going to, in my opinion, there's going to be better penetrance with that. When it comes to breaking down biofilms, in my experience using a biofilm disrupting nasal spray, ideally one that contains EDTA, is kind of my go-to in order to really get at biofilms. And sometimes we will add that to a nebulizer, and because sometimes we need to do that to really get at those deepest sinus recesses, or in the rare patient where there's actually some at least clinical evidence, if not other evidence, that there's some colonization of mold in the lungs or the lower airways, then sometimes we need to use nebulized biofilm disrupting treatment for those types of patients. So ultimately, getting those really sort of deep acting, deep penetrating treatments can be really important, especially for really, really tenacious cases. So I hope this information was helpful and of interest. If anybody has any follow-up questions to this or other questions in general, please post them in the comment section below and I'll answer them as soon as I'm able to.